Swayam Prabha. Digital India. Educated India.
Welcome to the session of course Therapeutic Nutrition. This is our fourth module, that is etiology, clinical features and nutritional management of weight imbalances. And this is the fourth lecture in which we shall be studying about nutritional management of underweight. I am Dr. Jaspreet Kaur, presently working as Assistant Professor in Government College for Girls, Ludhiana, Punjab, affiliated to Punjab University, Chandigarh. And this project is funded by DTH Swayam Prabha, MHRD, New Delhi. In the previous lectures of this module, we had studied about the management of one type of weight imbalance, that was overweight. And we studied the basics of body composition. Then we studied what are adipose tissues and their distribution. Then we studied how our body regulates its constant weight. And then we studied etiology, assessment, and type of overweight and obesity. And lastly, we studied about nutritional management of obesity. So in this lecture, we shall be studying about etiology of underweight, and then we will see what are the clinical features of the underweight and what is the impact of underweight on the health. And lastly, we shall be focusing on the nutritional management of underweight. When the body weight is 10 to 20% less than the average expected weight for someone's height, age, or gender, we call that person as overweight. And in underdeveloped countries or developing countries, this problem is usually associated with poverty or poor living conditions, or it could be because of some long-term disease also. However, in some conditions where there is physiological difficulty, which can actually make the weight gain difficult process, and maintenance of weight could be affected because of certain physiological conditions. According to World Health Organization, 462 million adults, they are underweight world over. And coming to children, 47 million children under 5 years of age, they are wasted. And 14.3 million, they are severely wasted. And 144 million, they are stunted. That is the world over situation. And around 45% of deaths among the children under 5 years of age, they are linked to undernutrition. So that indicates that how prevalent underweight is in whole world. Now coming to the scenario in our country, here half of Indian rural population is marked as underweight, and out of this population, up to 3/4 they are classified from the deprived communities. And chronic energy deficiency, which is the main cause of underweight here, is due to chronic food deficiency. So let's study what is the etiology, or what are the causes of underweight. The first and foremost cause of underweight is inadequate intake of food, which is poor in quality or poor in quantity or both. And secondly, it could be because of poverty and ignorance, where people, they cannot afford adequate food, and they are again unaware of what are the cheap or nutritious food alternatives. And along with that, many of our persons in the deprived societies, they are actually starving. And along with that, there could be some psychological factors, such as patients who are having mental illnesses, or persons who are having some eating disorder like anorexia nervosa, they refuse to eat food adequately. Then increase physical activity without increase in food intake, which leads to energy deficit. When people, they are exercising more, they are working out more without increasing their food intake. And then people who are tense, who are very active, or rather I would say overactive, who are nervous, and they get too little rest, that also increases the energy deficit in them, and it can lead to weight loss and underweight. And then malabsorption due to vomiting or diarrhea, that also leads to poor nutrition absorption, and this may be due to some gastrointestinal disturbances or because of prolonged use of laxatives. Then along with that, there could be some pathological conditions, such as it could be chronic fever, and in which the appetite is very low and energy needs, they are increased substantially. So it can cause weight loss. And then along with that, cancer, infections, they also increase the metabolic demands of the body, and they drain away the nutrient reserves. Certain hormone imbalances like hyperthyroidism, they increase the basal metabolic rate, and the energy needs of a person, they are increased substantially. And it may cause weight loss if the intake of the person is not increased. And then generalized weakness of unknown origin could be one of the reason, because such peoples, they will eat less and they will feel full with lesser food when we compare it to the intake of normal weight persons. So we can classify the underweight according to the recorded BMI of a person. According to World Health Organization, if the BMI is less than 18.5, we will classify that person as underweight. And when it is ranging between 17 to 18.49, we call that person as mild thinness. And if it is still lowered, that is between 16 to 16.99, we call that person as moderate thin. And when it is less than 16, we call it severe thinness. Now let's focus on the problems associated with the underweight. So what are the limitations? Here, among adults, the underweight, it could actually reduce the capacity of sustained heavy work, and it can lead to lower productivity. And underweight pregnant women, they have higher chances of getting underweight babies, and it increases the chances of complications during the pregnancy, which will lead to preterm and smaller babies. It can be leading to progressive illness, and the resistance to infection could be lower. And actually, the problem of stunting can worsen among children. And the age of menarche could also be delayed by about 1 to 2 years among young girls. Among starved children or adults, the fatty tissues, they are lost, and the skeletal and heart muscles, they are actually lowered, and the small intestine loses the absorptive power to a large extent, and this results in lower blood pressure. There would be marked emaciation. It would lead to loss of hair, and the skin will become inelastic. Now, this condition does more harm to infants and small children, and it will cause mortality and morbidity among them. Underweight and generalized malnutrition increases the healthcare cost. It will reduce the productivity. It will slow down the economic growth, and which will perpetuate a cycle of poverty and ill health, as we have seen this condition in many underdeveloped and developing states. Now, let's study how to manage undernutrition. So here the first and foremost thing is to seek what is the cause, what is the direct reason which should be treated. And it has to be planned in accordance to the suitability of the therapy, and it has to be according to the economic status of the person, his living conditions, and presence of any kind of disorder leading to underweight. So an important goal of management of underweight is that it should be combined with the dietary counseling, because proper dietary counseling will help in building good eating habits, and along with that it will help in selection of proper foods for good weight gain and its maintenance. And treatment must be given for any accompanying disease. So let's study the objectives of diet therapy for underweight. The first objective is to restore the body weight to normal, and secondly, to rebuild the body tissues and nutrient stores along with restoring the normal health. Then maintain desirable body weight and good nutritional status. The RDA of energy for an underweight person would be higher. We need to increase around 500 kilocalories daily to achieve a weight gain of half kg in a week. And if the weight gain is desirable more than half kg in a week, the intake could be increased by as high as 1000 kilocalories. The energy needs, they are still higher in conditions where the gastrointestinal tract disturbances, they are interfering with the absorption. We need to recommend higher amount of proteins to build up the muscle tissues, since because of consistent less intake of food, that leads to the depletion of the protein reserves, and that is why 1.5 to 2 gram per kilogram of body weight is desirable. And it is important that we include easily digestible protein which are coming from high biological value foods. And carbohydrates are to be provided in higher amounts to meet the higher energy needs. And along with that, they have another benefit that they will perform protein sparing action. This is an important action of carbohydrates where they will spare the protein to perform its necessary job, that is bodybuilding and repair. And the protein, they will not be used for providing energy. And along with that, the bulk should be decreased because it will cut down the food intake. The person will not be able to take larger amount of food. And fiber, it has to be just enough to regulate the bowel movement. We should not be going overboard on the fiber, because this will increase the bulk of the diet and the person will not be able to take that much of amount. We need to provide nutrient dense food in such conditions. Coming to fats, although fats, they are energy dense foods, they will help in reducing the bulk of the diet. But the problem in most of the cases is their intestines, they are not able to absorb the fat to its full capacity. So we should not be giving higher amount of fats. They should be given in moderation to meet the energy needs. And it is desirable if we give emulsified fats such as butter, cream, or whole milk, because they are better tolerated than the other kind of refined oils. Coming to micronutrients, that is vitamins and minerals, we need to go liberal in minerals and vitamins to retain the health. And here we can always provide some supplements to combat any accompanying nutritional deficiency, because these people, since they are taking so much of less food, they have multiple mineral and vitamin deficiencies. And it is good if we can include plenty of vegetables, fruits, and whole grain cereals and pulses, particularly in sprouted form, to ensure that adequate intake of mineral and vitamins is going inside their body, and it will help in restoring the depleted reserves of micronutrients. Fluids should not be taken before or with meals. It is important that they are taken after the meals so that the food intake is not reduced. And but we have to take fluids sufficient enough to avoid constipation. Now let's discuss some special tips to gain weight. Since it is difficult to increase the energy intake abruptly, so in fact it is a good idea to start with the normal intake and thereby increasing the quality and the quantity of the food gradually, so that their body is able to adapt itself nicely to newer kind of intake. And the person should be encouraged to have regular meals. They should take major three meals along with the snacks to improve the intake of the food. And due importance should be given to plan, prepare, and eat the food. And it is good to include energy dense foods in the diet. And the serving size can be increased by using bigger plates, and then we can go for bigger katoris or bigger glass, so that the person is able to take the larger amount of food without being psychologically feeling that I am taking larger amount of food. And then newer recipes they can be tried, which are nutritious also, and which are calorie dense, which are nutrient dense. And then appetizing and well served dishes, they can be added. Definitely they will help in gaining the weight. And it is good if we eat the food in good ambience and in presence of our friends or families, because the person will feel like eating when the whole ambience is good. And along with that, dietary supplements, they can be taken, because there are multiple deficiencies, and when these deficiencies are there, the appetite is suppressed. And along with that, a walk before the meal, that will also help in inducing hunger. So another important point is that a regular outdoor exercise is needed to stimulate the appetite. And along with that, it will also help in maintaining that the body is gaining on lean body mass also. Since we are giving energy dense diet to such persons to gain weight, so only adding fat to their body is in fact a bad idea. Once the person is exercising and doing any kind of physical activity, which could be light activity just like walking or doing stretching or doing some yoga asanas, they will actually help in preserving the lean body mass and adding some lean body mass along with weight gain, where the fat is also getting deposited because of positive energy balance. And good body composition is what we aspire for in this condition. And exercise with high calorie intake, as we know, it will ensure that the lean body mass is added, not just fat. And constipation, we know it can actually reduce the appetite. You must have experienced this condition yourself also. So the bowel movement, it should be regulated by taking adequate fluids along with exercise, as we have just discussed, and adding fruits and vegetable in various forms, such as in we can go for salads, or we can go for fruit chaat or something like that. And synthetic drinks and soft drinks, alcohol, aerated drinks, taking too much of tea and coffee, they are providing empty calories. So they will reduce the appetite. So here the main focus is to add on nutrient density of the diet. So hence these things, they are to be avoided. So let's summarize what we have studied in this lecture. We had studied that underweight is when the body weight is 10 to 20% less than the average what is expected for someone's height, age and gender. Then we studied about its prevalence and we saw that this problem is there in underdeveloped countries and developing countries where this problem is associated with poverty, poor living conditions, or along with that, long-term disease could be one of the reasons. And then along with that, physiological difficulty in gaining and maintaining weight could be one of the causes. Then we studied the etiology of underweight, where we studied that the prime cause of underweight is inadequate intake of food, which is inadequate both in quantity and quality. Then we studied that another major cause is poverty and ignorance, where people, they can't afford adequate food, or and they are unaware of cheap and nutritious food and other alternatives, and starvation could be another reason. And increased physical activity without increase in food intake can also cause weight loss and resulting in the lower body weight. And then along with that, certain kind of malabsorption problem or certain pathological conditions such as fever, along with that cancer, infection, then hormonal imbalancing, yeah, along with that eating disorders, they could be one of the reasons. Then we learned to classify the underweight according to the body mass index. According to World Health Organization, we learned that if the BMI is less than 18.5, we call that person as underweight. And if the range is between 17 to 18.49, the person will be called as mild thin. And then if it is between 16 to 16.99, we call that person as moderately thin, but the person will be called as severely thin when his or her BMI is less than 16. And then we learned the management of underweight, where we emphasize that the direct cause of the underweight should be found and treated. And then we studied that the planning should be according to the suitability of the management, according to the economic status of the person, according to the living conditions of that person, and any disorder which is causing this problem. And this whole management should be combined with the dietary counseling so that the person is able to build good eating habits and he learns how to choose the foods in a proper way. And treatment should be given for any kind of accompanying disease. An increase of about 500 kilocalories daily or higher may be recommended depending upon the extent of underweight and the underlying diseases. The protein level should be increased and the RDA is around 1.5 to 2 grams per kg body weight. And high level of carbohydrates are needed to meet the higher energy needs. But here we have to manage the fiber content because we cannot provide high bulk food to that person. And fat has to be given only in moderation to meet the energy needs. Excess of fat could already worsen the existing malabsorption symptoms. Liberal amount of minerals and vitamins, they are needed to regain health. Here we can always recommend some kind of supplementation so that the appetite of the person is restored, which is one of the main reason the patient is not taking adequate food. And then importance should be given to provide energy dense food. Here, the selection of food is very important. And water, it should be taken only after meals so that the food intake is not reduced. The patient should be encouraged to avoid any condition causing constipation, and this condition can be dealt by taking ample amount of water, fiber, and rest along with some kind of exercise. And regular outdoor exercise is needed to stimulate appetite. This kind of exercise could be light to medium intensity. We encourage exercise so that the weight gain is accompanied by increase in the lean body mass along with the fat body mass, and the body composition of that person is improved. So this finishes our today's lecture on undernutrition. Thank you.